Hello, can everyone hear me? Ayan. So now guys, welcome to our top-notch portal. Today we're going to have our Prevmed special lectures. All right, so please, tawag mo dito, look alive and listen well sa ating lecture for this afternoon. Okay? Wait lang, let's see if ano tayo sa co-host ko lang yung ating ano. All right. All right. So yeah. So now we are live at the portal. So welcome to everyone. Welcome to my babies. I'm so sorry. So yeah. So we have our with our Prevmed teacher.
Hello, good afternoon, everyone. I think Chappy si MG Troy, no? But before we begin, I would like to acknowledge first the presence of Dr. Broly. Dr. Broly, do you have any announcements or after the special lecture na lang?
No special announcements. Good luck and God bless for tomorrow's exam. Listen to Dr. Louis Man's lecture. Okay, this is the first time that we're conducting this. It's completely synchronous. No handout needed. It's going to be based on your main handout. And Dr. Louis will concentrate mainly on biostat. Yun yung part na medyo nahihirapan yung mga students. And he'll also try to cover other commonly asked topics from before. But please take note, our experience with Prevmed for the past 3 years, they always manage to insert new topics. So expect that Prevmed will probably be the hardest among the 12 subjects. Expect that there will be new topics na hindi talaga natin ma-predict because there's no recommended textbook for this subject. Okay? However, may laban kayo kahit paano with the lectures na binigay sa inyo ng mga teachers niya for Prevmed. Okay? So makinig din kayo for today with Dr. Louis. Louis, the
All
floor
right.
is yours.
All right. Thank you so much, Doc Broly. So again, students, welcome to, I think, no, talagang ako ang magsasara ng lecture season dito sa Top Notch because this would be the last lecture before your day 3 and day 4 for board exam. So good luck. I know everyone is really tired. Okay, kahit ako nung panahon na ako yung nag-exam din, day 3 and day 4, it's really dragging. It's really draining, no? Some of you hindi na nakakapag-aral. May mga napaparalyze na because of anxiety and fear. It's okay. It's normal. But we will try to help you pa rin as at the last minute before your day 3 and day 4. So again, I am Dr. Louis Mann and welcome to your Prevmed Special Lecture. So isang request ko lang muna sa ating mga students sa portal at saka dito sa Zoom, please prepare a calculator. So at least nagamit natin yung preparation, yung calculator na yan, even sa preparation lang. So hopefully, no, after this lecture, maging confident na kayo na gamitin yung calculator nyo tomorrow at I mean day 4 para sulit rin ang pagbili. Okay, so if you are ready, nakuha na ang calculator, better din, no? Meron kayong mga notepad dyan, okay, lapis, ballpen, so at least if we will compute later on, mas mabilis na. Don't worry, I'll give you like 2 to 3 minutes to solve. Okay, basically yung atakihin lang natin ngayon is yung mga basic formula. And just a disclaimer, halos lahat ng mga topics na ipag-uusapan natin ngayon, ito yung mga usual na mga natatanong or yung mga topic na nako-cover from the past 3 board exams. So hopefully, no, maging sulit yung pag-stay nyo and after this, makatulog na kayo ng maayos. But before that, pag-warm up na muna tayo. So pag pinag-usapan natin ang top 1 cause of mortality here in the Philippines for the last 3 years, specifically, it is your ischemic heart disease. But there are permutation in the choices and in the board exam, it can be cardiovascular disease. So again, here in the Philippines, ang number one cause na pumapatay sa mga Pilipino ay ischemic heart disease or sakit sa puso. So remember that. Okay, baka itanong ulit yan, at least confident ka na. Ngayon, maraming nalilito. Ang number one cause of morbidity naman o yung dahilan kung bakit na hospitalize ang mga pasyente, mga Filipinos, because of your acute respiratory infection. Now, if there's no acute respiratory infection sa inyong choices, as long as may respiratory component, that is already acceptable in your morbidity. Again, important to remember, top 1 mortality, ischemic heart disease or cardiovascular disease. Your top 1 morbidity is acute respiratory infection. Okay, so I'll be opening and monitoring the chat box. I'll be using this as an index, no? Especially yung mga nasa Zoom natin, you can type in your answer if you are done computing. So at least I know when to move on sa topic na yon. Alright, so request ko sa ating mga Zoom babies or sa Zoomies natin, maging interactive tayo ngayon. No? For the portal tips, it's not an excuse for you to magsumagot, no? As much as possible, try natin sumagot. First high-yield topic natin is your infant mortality rate, okay, or your IMR. Remember the formula of your infant mortality rate. This is lifted from your handout. Your IMR, no, the numerator here is the total number of deaths under 1 year of age. And then the denominator is the total number of registered live births of the same calendar year. So, and then you multiply it with the factor of 1,000. Ang tips ko sa inyo ganito, kapag lalabas sa exam yung case nyo, bibigyan kayo ng napakaraming numbers. Bibigyan kayo ng iba-ibang klase ng deaths. No, number of census ng deaths ng maternal mortality, neonatal mortality, child mortality. Pero remember, you go to the question. Excuse me, kung ano yung hinahanap, infant mortality. So ibig sabihin, yung i-account nyo lang sa numerator nyo dapat is yung mga deaths under 1 year of age or yung mga infant lang. So better to screen na kagad, i-highlight nyo kagad yung mga important numbers sa case once na pinagko-compute kayo. And then madali lang naman lagi ang registered live births. No? Kung hindi man siya registered live births, total number of births within a period of time. Minsan bibigyan kayo ng census 3 years, 2 years, pero maging responsive kayo sa tanong. Kung 2022 lang ang tinatanong, 2022 data lang ang i-compute nyo. Alright? So as a review, alam natin na ang infant mortality or infant death is death of an infant under 1 year of age. Remember this, under 1 year of age. Kasi minsan nagkakatalo, linilito kayo sa definition ng age group. So all in all, ang infant mortality rate natin is the measure that measures the risk of dying during the first year of life. Okay, second approach natin dito, ito yung usually talaga natatanong. Why is it important to monitor or to know the infant mortality rate? Because it is a good index of the general health condition of a community. Okay, because of the infant mortality rate, nakikita natin yung changes not just in the medical condition of that community, but also of the environmental community. Just to give you an idea, okay, well, hindi naman to natanong, pero part ng readings and literature na meron tayo, ang number 1 cause ng infant mortality rate is sepsis. Okay, so just imagine that. So kung sepsis ang kinamamatay ng ating mga infants, then basically baka marumi ang environment, okay, marumi ang bahay, so ayun yung dalawang minomonitor natin. But all in all, pag sinabing good health condition, monitor the condition of the health in a certain community in the context of environmental and medical, and then you answer your infant mortality rate. Okay? Sige. So, comfortable na tayo dito ha. Let's try to compute for the IMR. So, these are the data. I'll give you 2 to 3 minutes to compute. For the year 2022, you have the following data. Total number of live births, 15,000. Number of deaths under 1 year old, 150. Number of deaths, 2 to 4 years old, 180. Maternal death, 130. Deaths under 28 days, 130. So what is your infant mortality rate? What is your answer? Sige. You have 2 minutes to compute. Request ko sa ating mga portal, tips, and sa ating mga Zoomies, please be interactive. You can type in your answer so at least I know na I can move on na. Alright, so marami na ang sumasagot sa ating chat box. And I've seen 2 different answers and it's acceptable. Alright, so let's discuss first yung sagot ng marami. Marami sa inyo ang sumagot ng 10% or 10. Kasi nga naman, pag pinag-uusapan ng infant mortality rate, ano ba ang sinabi ko kanina? Death of an infant under 1 year of age. So, ibig sabihin, less than 1, okay, over the total live births. But I will give you one more chance to correct it. Based on our numerator, dito sa ating data na to, ilan dito ang less than 1 ang criteria na pasok? It is your under 1 year old and your deaths under 28 days, correct? So kung ang sinagot nyo ay 10, partially correct kung wala yung neonatal deaths na 130. Kasi, strictly speaking, kung ang pag-uusapan lang natin ay yung number of deaths under 1 year old, kasama doon yung mga neonates. Correct? So ano dapat ang tamang sagot? Pero ito yon guys. Kung nakuha nyo yung 10, very good. At least alam nyo yung formula. Alam nyo i-apply. Pero again, comprehension is the key. You read the question carefully because the correct answer here is 18.66. Why? Because you need to add that's under 1 year old and then you add your 130. This is a trick question just to make you realize na sometimes you know the formula, you know the knowledge, you know the theory, but meron kayong poor comprehension or minsan excited kayo sumagot. Why? This is the last subject of the board exam. You are really tired. For now, yung iba sa inyo, matapos na lang, wala na akong pakialam. Pagod na ako. And guys, to tell you honestly, sobrang haba ng mga questions sa Prevmed. Dito, it is already testing your character and your endurance and your stamina. So wag kayo bibitaw. You read the whole case, you read the sentences, you read the paragraph carefully. Okay? Now, I just wanted to make a point here. Since we are talking about the number of deaths, kapag wala sa choices ang 18.66 at may nakita kayo na 18 or 19, these are the better answer. I have a question here kung hindi daw ba kasama yung 130 under the subset of your 1-year-old. Now, for this data na ginawa ko, I just wanted you to understand na hindi siya subset noon. Binilang less than 1, etong death under 28 days, 1/3. Okay? For the sake of just making you really comprehend the question. Okay? Pero minsan kasi, you need to take the total number. Okay? Now, syempre, sa choices, kung wala yung 18.66 at nakita nyo yung 10, then you choose 10. But for the sake of my point here of comprehension, then go ahead. Okay? Sige. Move on tayo, ha? So, 18.66. Tanong ko sa ating mga students, pag pinag-uusapan natin ang type of data, 18.66, is it a continuous or discrete type of data? You answer. 18.66, is it a continuous or discrete type of data? That's a simple question. You need to answer. It is a continuous type of data. The fact na meron kang decimal points, continuous yon. Pero in the context of biostatistics at ang pinag-uusapan natin ay people or tao, walang 0.66 na tao. So you can round it off to the nearest 10. No? So here, best answer is 19. Okay? Now, kung walang computation sa boards, okay lang. Pero kung usually kasi ang tinatanong talaga is the interpretation of the number. How do we interpret that? Okay, how do we interpret that? Meaning, no, kung 10 ang sagot nyo, for every 1,000 infants born, 10 infants did not survive to reach their first birthday. Okay, this is how we interpret the infant mortality rate. Now let's move on to the next slide. This is another permutation of your infant mortality rate. Tinanong ito sa boards. What would the 2% decline in infant mortality rate this 2022 indicate? If the data last 2021 is 19.92. Okay? So tinanong yan. Now, how do we interpret that? Okay, for every 1,000 infants born, 18 did not survive to reach their first birthday, correct? So since there's a 2% decline, gawin na natin tong 20, so minus 2%, that is 18%. Okay, now we can also interpret this as there is a reduction of infants who died under 1 year. Okay, and then improvement of health outcomes since nag-decline ang infant mortality. Kakaintindihan? So, ganun yung mga permutations, ganun yung mga atake sa isang formula. Pwedeng directly, pwede kayo pagpipitin. Second, pwede kayong mag-interpret. Third is common sense, interpretation of that data. All right. Let's try to refine it further, yung knowledge natin doon. This is the case. Death of a 1 year, 5 months old patient will be computed under which mortality statistics? Anyone? Ano ang sagot? Anong mortality statistics ang gagamitin natin kapag ang point ay 1 year, 5 months old? Anyone from the group? Sige, isip. Alright. Very good. It is your child mortality rate. But previously, take note of this, Ang alternative ng child mortality rate natin ay your under 5 mortality rate. Okay? So you can answer child mortality rate. Pero kung wala sa option ng child mortality rate, best answer is your U5MR or your under 5 mortality rate. So what is your formula for your under 5 mortality rate? It is somehow similar to your infant mortality rate, but this time you are taking into account yung number of deaths of children under 5. Okay, and then live births pa rin, you multiply it by 1,000. Doc, wala tong under 5 mortality rate sa handout namin. Well, because it is in your concept, but in your handout, you can see here, it is your child mortality rate. Okay, so number of deaths, 1 to 4 years old, and then total population of children ages 1 to 4 years old. Pero syempre, mas encompassingly, parang mas malaki yung sakop ng ating under 5 mortality rate. Ang pinapoint out ko lang dito is, kailangan alam nyo yung mga ibang mortality. But ito lang na may mga identified din. Now, as a review, your neonatal is under 28 days of age. Okay? So kapag pinadefine sa inyo yun, it is the first 4 weeks of life. 7, 7, 7, 7. 4 weeks. Kasi in 1 week, you have 7 days. Pero if you want to refine it further, meron tayong sinasabi na early neonatal, it's 0 to 6 days. And then we have late neonatal, 7 to 28 days. Okay, so what is the formula of your neonatal mortality rate? No? Saya-saya kasi kaparehas lang yun ang mga kanina mortality rate. This time, ang pinag-uusapan yung mga deaths under 28 days of age in a calendar year. And then you have your number of live births in the same year. Ang factor natin dito lagi 1,000. Okay? Now, must know din ang neonatal mortality rate nyo due to prenatal or genetic factors. Pero ang perinatal mortality rate, no, mas pinaano lang siya, mas pinasmalaki lang yung scope niya. So we have here early neonatal deaths plus your stillbirths, okay, over total births multiplied by 1,000. Why am I teaching this? Because ginagamit madalas ang perinatal mortality rate as an option na pampalito. So you need to be very careful, okay? So alam mo na yung infant, neonatal, perinatal, and your child mortality rate. Kasi ayan yung apat na laging pinaghalo-halo sa mga options. Okay? So we're good to go. Next is let's talk about your attack rate. Yes, may question dito, no? Wait. May question tayo dito. Kapag ba pinagko-compute kayo ng under 5 mortality rate, isasama nyo na rin ba yung data ng infant mortality rate? Kung makikita nyo dito, at 1 to 4 lang. So yung mga less than 1, hindi sila kasama. Okay? So be responsive lang. And then lagi kayo magte-test. Kapag may option kayo sa exam ng mga numbers, you try to compute. Tignan nyo kung ano yung lalabas. Kung ano yung na-compute nyo na yung lumabas, ayun na most likely yung correct answer. Okay? Let's move on to the next computation natin. Remember the attack rate formula. Number of new cases among the population during the period over the population rates at the beginning of the period. Okay? You multiply it by 100. So let's try to have a case. I'll give you 2 minutes to compute. I'll move on once na may nag-chat na. Alright, marami na ang nagpapasok na kanilang mga sagot. So here, kailangan nakuha nyo yung 125 as a total population. And then here, nakuha nyo yung mga cases, 15. So simply, you just need to supply lang 15 over 125 and then you multiply it by 100. So you will get here 12. So the attack rate is 12. Alright? Sige, I know very draining ang computation. Let's have a tanggal umay lang. Pag-usapan natin ang bioethics. Well, nakapag-legal med na kayo, wala pa ako ng feedback nyo, pero not sure kung may natanong ba na mga bioethics principles. Meron ba? Ayan. So here, we have 2 sets of your principles. Itong first column natin dito, ito yung, kumbaga, ito yung laging, sila yung OG. Sila yung pag pinag-usapan ng ethics, bioethics, automatic, you have your autonomy, beneficence, non-maleficence, and your justice. Okay? Pero kasi for the last few exams, nagpapasok na sila ng mga philosophical ethical principle. Okay? Dito na lumalabas yung solidarity, stewardship, double effect, subsidiarity, and your cooperative. So as a review lang, no, let's try to review your bioethics. Kapag pinag-usapan natin ang informed consent, for sure, a lot of you already knows this, no, na yung patients nyo dapat voluntary and well-informed about the medical intervention or procedure na gagawin. Kaya kung babasa nyo yung mga informed consent na usually pinapapirmahan ng mga nurses, okay, nandoon yung instructions kung anong mangyayari. Okay? So, one component lang yon. Kapag pinag-usapan natin ng autonomy, respecting an individual's right to make decision about their own life. Autonomy, autonomous. Beneficence, other term here is do good, to act in ways that promote the well-being and best interest of their parents. Ang non-maleficence nyo, do no harm. Now, ang other term nito na pwedeng gamitin nila as an option is your primum non nocere. Okay, your primum non nocere, it translates to do no harm. And you know that if you will not do harm, then it's non-maleficence. You avoid causing harm to your patients. And then justice, fair and equitable distribution of resources, opportunities, and benefits. In our context, in healthcare. Now, ito yung challenging para sa iba. Okay? Solidarity, there's unity, shared responsibility, and mutual support among individuals and groups. Solid tayo. Solidarity, unity. Stewardship, pangangalaga. So responsible management and care of resources, no? Ang pinaka-common is stewardship of the environment, pangangalaga ng health. But in the hospital context, it's stewardship of the resources. You taking good care of the resources, hindi kayo masyadong maaksaya. Alright? And then a principle of double effect, in every action, you have the good and the bad consequences. And basically, you weigh, no, dapat mas malaki ang good consequences than your bad consequences. Ang subsidiarity nyo naman is you subsidize the power or the decision. No? Usually, it should be handled at the most sa local level na de-decentralize yung decision-making context. And then your cooperativity, syempre, cooperation. Engage in collaborative decision-making processes. Okay, so remember this kasi maraming nahirapan dito. For sure, alam na alam nyo na to kasi lumabas to sa Legal Med na discuss. Pero ito, additional lang for preventive medicine and public health. All right? If there's a question here, would like to discuss, what if the case tells you that a management to the patient may cause pain but will benefit their health. Actually, yung context mo, medyo kulang. Pero doon sa binigay mo, pwede siyang double effect. No? Kasi nga, yung double niya is, ang bad consequence na is, it will instill pain to the patient. But the good effect is, matitreat or magbe-benefit yung health niya. Pero kung hahaba palalo yung case, no, pwedeng maging ano yan, pwedeng maging beneficence yan. Okay, so be careful lang sa mga cases. Okay, so I've been reviewing a lot of feedback. No, ito yung mga mostly recurring loss. Kasi for sure, medyo tinatamad ka na mag-aral. Yung iba, for sure, inalay nyo na yung mga Republic Act. Pero yung mga important that I want you to remember by this time is this different Republic Act. Again, everybody, no, repeat after me. Republic Act 1, 1, 2, 2, 3. Diba? Very easy to remember. 1, 1, 2, 2, 3. This is your Universal Healthcare Act. Dapat lahat kayo alam na alam nyo na yan. And then yung mga previously na-identified is your RA 9165. This is your Dangerous Drugs Act. 9165. And then you have your 11332. This is for your surveillance and response to notifiable diseases. Okay, and then your RA 10173, your data privacy. Ewan ko na lang, since medyo hindi na daw gumagana at active learning, hindi na active learning, no? O ito, 101 Dalmatians, no? Okay? So, they need privacy. Okay, and then ito, very easy, rhyming words lang. 91, ako the way I read this is 9165, no? Very dangerous. And then your surveillance is 11332. So ito yung mga identified, 5 yan. 1, 2, 3, 4 lost. Okay? And then isang topic pa na high yield then is your direct contributors versus your indirect contributors. Ito yung mga nagbabayad sa PhilHealth. Okay, PhilHealth. Okay, pag direct contributors, ayun yung mga employees with formal employment. Pag sinabi sa case na siya ay empleyado ng gobyerno, ng hospital, kahit anong office pa man yan, okay, or public yon. And then private, there's employee to employer's relationship. Okay, that is a direct contribution. Ang mga kasambahay nyo, it's a direct contributor. Self-earning individuals, professional practitioners. Dito tayo under kung ikaw ay moonlighter. Kung moonlighter ka, you are a self-earning individual. Pero kung ikaw ay doktor, pero you are employed under a public or private hospital, that is with formal employment. OFW nyo, Filipinos with dual citizenship, lifetime members are direct contributors. Ano yung mga lifetime members? Baka lituhin kayo. Ayan yung mga 60 years old pataas, mga senior citizen na nagbayad at least 120 months ng premium contribution. Alright? Okay. And then all Filipino aged 21 years and above with capacity to pay. Ito mga indirect contributors, mga indigents identified by DSWD. Once na may nabasa kayong DSWD, most likely you are talking about indirect contributors. Mga beneficiaries of your Pantawid Pamilya Pilipino program or your 4Ps. 1, 2, 3, 4. Senior citizen na hindi nakapag-contribute ng 120 contributions. Kumbaga, tumanda na lang siya na walang PhilHealth, automatic pasok siya under indirect contribution. Okay? Ano moral lesson? Huwag na tayo magbayad, joke lang. Magbabayad pa rin, mag-share pa rin tayo, no? Kung lahat naman pala aabot ng pag naging senior citizen na ay magiging indirect contributor. Well, much better pa rin. Paano kung nagkaroon ka ng sakit before 60, di hindi ka pasok sa PhilHealth. Okay? Persons with disability, automatic yan. And then, yan, napapanahon. Okay, boboto na ba kayo? Your Sangguniang Kabataan officials. And then previously identified at point of service, sponsored by LGUs. And then yung mga ages 21 years old without the capacity to pay fees. There's a question here. Disabled pero employed. That is a direct contributor. Again, mas high ang natin sa direct contribution. If there's employee to employer relationship, automatic direct contributor yan. Kaya si Hodang ikaw ay naka-wheelchair, ikaw ay legally blind, kasi for sure, you have the HR paying for your premium. Okay? Sige. Ayan. So, hopefully, mas maging comfortable tayo sa direct and indirect contributor kasi lagi tayong linilito dyan. Okay? Sige. Kalma muna tayo ng utak. At least sa pagpag na natin yung toxicity ng pagko-compute later. Let's talk about mean, median, and the mode na hindi nawawala sa exam. As a review, alam natin ang mean, ang other term na is average. Okay? So it is the sum of all values in a data set divided by the number of values. Okay? Alam nyo na yung average. And then we have the median. It is the middle value, kung ano yung nasa gitnang value. But ito yung madalas na kinakamalian ng maraming estudyante. Dapat yung data set nyo, inarrange siya from lowest to highest. Kung ano yung nasa middle value, ayun yung median nyo. Pero be careful. Usually kasi ang mga data set natin, ang total number of your observations or the data set, pwedeng maging odd or even. Yung even ay yun yung divisible by 2. Yung odd, not divisible by 2 ng exactly. So ang note ko dito, tandaan nyo, if the calculation, if you have a data set which is odd, okay, kung ano yung pinaka-middle value, ayun na yung inyong median. Pero kapag even number, you have 2 middle values. Ano yung gagawin nyo doon sa 2 middle values na yon? Okay? You add the 2 middle values, you get the average. That is your median. Ang mode naman, value that appears most frequently in a data set. Now, before I give you a computation, ectopic pregnancy, okay? Tapos aalisin na yung inyong embryo. Ano daw siyang principle in ethics? double effect, no? Kasi kung hindi pa ruptured yung fallopian tube at nandoon pa yung embryo, ibig sabihin buhay pa yon. But we are applying the principle of double effect. Okay? Kasi nga naman, the bad consequence is you're going to terminate the life of the embryo. But you're going to save the mother's life. Double effect yun. But again, do not focus too much on these special types of principles. Ang expected pa rin for a GP level is, you know, the autonomy, justice, beneficence, and non-maleficence or primum non nocere. All right. Let's have an application in your mean median mode. Personally, ako, nung nag-board exam, I got this kind of question. Okay, it's a very long case, tapos bibigyan kayo ng mga random numbers. Okay, so suppose this is a data set given to you sa boards. Ang tatanungin sa inyo is, what is the mean? What is the median? And what is the mode? Okay, I'll give you 2 minutes. You compute for the mean, the median, and the mode. Okay, 1 more minute. Then I'll show the answers na. Pero mas maganda, Doc, sumabay ka para ma-practice. For sure, ito na yung huling practice mo. At least ngayon, guided. Alright, may mga pumasok ng sagot. Very good. So, meron dito, what is our mean? Okay? Our mean here is 83.5. No? You just add all of this. 70 plus 75 plus 80, 85, 90, 95, 75, 85, 88, 92. Sum, the summation of it. And then you divide it with how many data set? How many observations? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the sum over 10. That is the mean. Now, in the median, okay, dapat nag-arrange ka. Nag-arrange ka ng dataset mo para makita mo yung median. Ano ang klaseng dataset ito? Is it odd or even? So this is even kasi nga dalawa yung middle value. And luckily, yung middle value mo parehas 85. Okay? 85 plus 85 divided by 2 is still 85. Very good. Now, what is the mode? Dito tayo ngayon magkakalituhan sa mode. Kasi ang mode natin, dalawa. Your 75 and your 85. Okay? Ang tawag mo doon ay bimodal. Dalawa ang mode. Okay? Hindi lang pwedeng isa, unimodal. Okay? Pwede siya maging dalawang mode, bimodal. Actually, pwede rin siya more than 3. Ang tawag mo naman doon ay polymodal. Okay? So, ang realization natin this time, when we talk about mode, pwede ka magdalawa, isa, tatlo, apat na mode. But this time, it's bimodal. Ano ba yung mostly frequently na occurring number? Your 75 and your 85. Okay? So that's simply your mean, median, and mode. Ano ngayon yung tip ko sa inyo? Sipagan nyo, galingan nyo. Huwag lang isang beses babasahin yung question, especially if you are transferring or writing down the numbers. Ang gagawin mo na muna, bilangin mo yung total number of observations. For example, binilang mo siya 12. 12 yung observation, you count it again. And then, you write it now individually. And then, you total it if it's really 12. Okay? Para hindi kayo magkamali. Kasi sayang. Okay? That is your mean, median, and mode. Now, let's go to your empirical rule. Now, your empirical rule is just the 68, 95, 99.7 rule. But I want you to recall your normal distribution curve. Ang other term niya is your bell curve. And kung lilituhin kayo na ginamit na last time is your Gaussian or your Gaussian curve. So if you see a bell curve that is symmetrical on the left and the right, we can say that this is normally distributed or it's a bell curve. Now, from the word bell, because it looks like a bell. Okay, now how do we apply the 68, 95, 99.7 rule? Ang number one rule natin, dapat it is normally distributed. The fact na makakita ka ng bell curve, it's normally distributed. Now, in the middle, you know that it is normally distributed. Usually, the mean is equal to the median and equal to the mode. So, pinaka-center yon. So, mangyayari, usually we have three standard deviation to the right and to the left. So, ang starting point natin in the middle is 0. Here, plus 1, plus 2, and then plus 3. Dito naman, since to the left, it's minus 1, minus 2, and minus 3. Ang sabi sa empirical rule, within one standard deviation to the left and to the right, the total observation there is 68%. Within two standard deviation, the total observation there is 95%. And within three standard deviation, the total observation is 99.7%. Going back to your handout, nakalagay dyan, yung two tails ng inyong bell curve never touches the x-axis because the possibility is infinite. But the infinity of that is very minimal lang. No? Kuha pa din natin yung 99.7%. Okay tayo doon? So remember this empirical rule. Kasi i-apply na natin yung knowledge natin dito. Application. I'll give you here 3 to 4 minutes. Ang expectations ko sa inyo here is that you will use this blank bell curve and then you supply all the information needed. Now, what is the scenario? You have collected data on 300 patients, wait times, and found that the mean average waiting time is 60 minutes and the standard deviation is 10 minutes. In order for you, remember this, listen to me, para magkaroon ka ng magandang interpretation of a normally distributed curve, you need to have the mean or the average, and you need to have data about the standard deviation. And again, sa buzzwords, diniscuss ko na yung measures of dispersion. Remember, yung range, yung variance, yung standard deviation, at saka coefficient of variation. Earlier, sinabi ko na ang standard deviation will give a meaningful interpretation in a bell curve. So ang standard deviation nyo is just a measure of movement away from the mean. Kaya nga siya merong plus 1, minus 1, plus 2, minus 2, plus 3, minus 3. Now, given the following data, try to fill in this bell curve. Go. Sabihan nyo na ako if you are done. Siyempre sa chat box, hindi nyo naman mapapadala yung picture ng bell curve. Okay, meron na tayong tapos na estudyante. So, ibig sabihin, medyo tapos na rin kayo. Now, this is how you make it. First, you need to get the mean, which is 60, and it's in the middle, 60. At ang standard deviation natin is 10. So, you just need to add 10. 10, pag dito, 70. Okay. Dapat dito, this should be 80. And then this should be 90. Tapos dito, 50, 40, and then this one is 60, 50, 40, 30. Sorry, kasi ang ating standard deviation movement niya ay 10, hindi pala 5. Sorry. Okay? So, ngayon, kapag tinanong kayo, okay, ang 68% of our patient typically wait between how many minutes? Huwag niyo to pansinin ha. Sorry, nagkamali ako ng pagsulat ng ating standard deviation. It should be plus 10, not plus 5. So kung 68%, alam nyo na it is between one standard deviation. Okay? So ang waiting time natin should be 50 to 80. Okay? One standard deviation. Okay tayo doon? And then, kung 2 standard deviation, ang waiting time nyo ay 40 to 80 minutes. Okay. So let's have this, since you know na on how to interpret the bell curve, let's try to apply it. Ito, same, parang almost the same case sa board exam. I'll give you another 2 to 3 minutes. Among women aged 18 to 34 in a community, okay, the weight is normally distributed with the mean of 52 kilograms and a standard deviation of 7.5 kilograms. Ang question is, what percentage of women will have a weight over 59.5 kilograms? Okay, may nakasagot na dito sa atin. Okay, so again, if you're going to make the bell curve, ang ating mean ay 52 kilograms. Tapos ang ating standard deviation ay 7.5. So plus 7.5 to the right, it's 59.5. Minus 7.5 to the left, 44.5, 37, 29.5. Plus 59.5 plus 7.5, 67. Plus 7.5 is 74.5. Pero ang tanong natin, anong percentage daw of women will have a weight over 59? So ito yon, itong shaded area na yon. Okay? Itong shaded area na yon. And if you're going to add it by this time, naalala nyo pa yung 68 empirical rule natin, 99.7 rule, that is just divided into the left and to the right side. Tignan nyo tong first standard deviation natin, yung red. 68, 34 to the left, 34 to the right. So that is 68%. Since ang pinag-uusapan lang natin, ilang percentage daw na mga kababaihan ang weight nila ay over 59.5. So you add the percentage here. 13.5 plus 2.35 plus 0.15%. The answer should be 16%. Okay? What if ang sinabi dito, ang total number of participants mo dito ay 300? Sabihin na natin ha, listen carefully. Kung 300 ang participants natin dito, ilang participants kaya ang may weight over 59.5? May nakasagot na, pero I'll give you more time. Ilang kayang participants ang may weight na more than 59.5. Very good. You just need to multiply your 300 to your 16%. So 300 times 0.16, you'll get what? Mag-calculator din tayo. 48. So you have 48 participants na nag-weigh ng more than 59.5. Okay, so we are done with the empirical rule. Let's move on to your odds ratio na medyo pinakompute din last time. So as a review, okay, ang odds ratio nyo, pwede kayong bigyan ng mga cases. Pwede siyang disease status or cases. Here naman, pwedeng exposure, pwedeng intervention. This is our usual anatomy of your 2x2 table. No? You have your A cell here, your B cell, your C cell, and then your D cell. Now let's try to compute using this formula. In a study of the effectiveness of a new treatment for a specific health condition, okay, you will compute now for the odds ratio. Ang binigay sa inyo na information is in the group A, you have 60 out of 100 patients recovered. In group B, yung control group mo, you have 30 out of 100 patients recovered. Now, let's try to compute. Ang expectation sa inyo is makagawa kayo ng 2x2 table. With this given information, can you now compute for the odds ratio? Go. Again, sige, balik ako dito. Ito ang formula ng odds ratio nyo. Wait, mape-preempt ko pala kapag linabas ko ang formula ng odds ratio. Usually, ang formula ng odds ratio nyo ay AD over BC. AD over BC. Okay. So, gawa muna kayo ng 2x2 table. Kapag nagawa nyo na yung 2x2 table, then we'll compute for the odds ratio. Go! Okay, meron nang nakasagot, guys. Okay? Now, this is your 2x2 table. Okay? Dapat marunong na kayo gumawa ng 2x2 table by this time, ha? So, dito, with treatment tayo, without treatment, with recovery, without recovery. So, sa treatment group daw, 60 ang nag-recover. Kaya dito, 60. Automatic, syempre, kung total mo ay 100 patients, ang remaining mo doon ay 40. Doon naman daw sa control group or without treatment, 30 ang nag-recover. Kaya with recovery, syempre yung remaining doon ay yung 70. Now you have your 2x2 table filled up. So you just follow it. A, B, C, and D. So AB over CD, correct? Kung papakita yung formula, this is based from your handout. Sorry, AD. AD pala. AD over BC. Correction. Ayan. So, AD over BC. So, you just supply the information. So, your A here is 60. Your D here is 70. And then over BC, your 30, you multiply it by 40. So, you will just get the answer here. I-divide nyo, you will get an answer of 3.5. Now, this is a continuous type of data, but since we are talking about patients, wala namang 3.5 patient, we can make it 4, no? Now, how do we interpret a 3.5 na odds ratio? This is how we interpret it. Kasi ganito, minsan hindi kayo pinagko-compute pero bibigyan kayo ng odds ratio. Now, if your odds ratio is 1, meaning the treatment does not affect odds of recovery. Walang effect. Kapag ang odds ratio mo is more than 1, treatment is associated with higher odds of recovery. At ang odds ratio mo ay less than 1, treatment associated with lower odds of recovery. So since we have our answer na here, which is 3.5, okay, we can say that the treatment is associated with higher odds of recovery. So please remember that. All right? For the odds ratio and relative risk, ang 1 naman usually no effect. So let's try to refine again. Refine. Kasi ang pinag-usapan natin sa odds ratio dito, treatment. Ang pag-usapan naman natin this time is your exposure. Okay? Your exposure and your outcomes. Now, given this data, try to make a 2x2 table and then you compute for the odds ratio. Go. Okay. May mga nakasagot na. By this time, dapat hopefully, no, tama na kayo. Pero kung hindi, okay lang. Hindi naman ito ang board exam. Okay, so I'll be showing here your ano ulit, your formula of your odds ratio, your AD over BC. Okay. Now, here we have your with cancer and then without cancer, your smokers and your non-smokers. No? In this 2x2 table, yung smokers and non-smokers, these are your exposure. Okay, so again, among the cases, 40 individuals are smokers and 10 individuals are non-smokers. So cases natin is your cancer. So yung cancer, 40 ang smoker, 10 ang non-smoker. Now, among the control daw o yung walang cancer, okay, 20 individuals are smokers, tapos 30 individuals are non-smoker. So kung nakuha mo na itong 2x2 na to, nako, good sign yan. Very good. Now, again, ano lang, supply mo lang 40 times 30 and then 10 times 20. Actually, ang odds ratio, it's the crisscross. It's the crisscross computation. Odds ratio. The crisscross. Okay? Mag-April boy ka lang kapag nakalimutan mo yung odds ratio. Okay? It's the crisscross. Okay. Now, how do we interpret an odds ratio of 6? Again, palitan mo lang yung terminology. Smoking now is associated with higher odds of lung cancer. Kung mapapansin nyo, yung interpretation natin, yung first word here at saka yung last word here, pinapalitan lang natin siya based doon sa ating kaso. Kanina kasi treatment, tsaka recovery. Ngayon naman, smoking and lung cancer. Okay, again, with odds ratio, 1, no effect. More than 1, associated with higher odds, less than 1, associated with lower odds. Very easy to remember. Again, congratulations. It's a good sign kapag nakuha ang tamang sagot. Kung hindi, may time ka pa. Now, syempre, hindi magpapatalo. Kung may odds ratio ka, dapat may relative risk. Oh, by the way, guys, feel good question. So, ang odds ratio, usually we use that in which study design? In which study design we use our odds ratio? Very good. Your case control. Now, your relative risk favorite, usually used in what study design or epidemiological study design? It is your cohort. Very good. Ayan, very interactive naman. Nakaka-proud. Thank you so much. Ayan, no? Nasisipangs na ako. This is my last lecture for your batch. Okay. Now, let's calculate for the relative risk. Okay, calculate the relative risk of developing heart disease for individuals who are physically active compared to those who are physically inactive. Okay, provide an interpretation of the result. Now, this is the basis. Group A, you have total of 500 individuals. Group B, yung inactive nyo, 500 pa din. Now, in Group A, ang physically active, 50 individuals have developed heart disease. And then in Group B, physically inactive, 100 individuals have developed heart disease. Now, you make a 2x2 table, and then using this formula. Again, this is not odds ratio anymore, ha? Do not do the crisscross computation. Okay? Compute for the RR and try to interpret it. Go. Okay. Meron nang nakasagot. Okay, so very easy lang. Again, if nakuha nyo tong 2x2 table na to, good job. Okay, with heart disease, meron tayong 50. Alright? And then, ang inactive natin, ang sabi dito, 100. So, ang total natin na may heart disease is 150. Now, yung without heart disease, syempre, minus mo lang kung ano, 450 for the active, and then 400 for the inactive. Okay. Now, how do we compute for the relative risk? Since we're just going to supply this formula, dapat ganito yung naging computation natin. Okay. A over A plus B. So A is 50, A 50 plus 450 is 500. Now C over C plus D, your C here is your 100 over 100 plus 400, which is 500. So you will get an answer of 0.5. So if you get an answer of 0.5, okay, very good. Now let's try to interpret it. What is the interpretation if you have a relative risk? Again, relative risk na ang pinag-uusapan natin. If less than 1, meaning it is protective effect. It's a protective factor, less than 1. If more than 1, harmful effect. And kapag is equal to 1, no effect. No? Masaya to kasi kaparehas ng odds ratio nyo. Again, less than 1, protective effect. More than 1, harmful effect. So, napag-usapan na natin yung most common na pinapa-compute. No, may season kasi guys, no, na may computation. Yung iba nga ay may season na may computation, may season na walang computation pero puro interpretation. Yung iba nga nagrereklamo pa kasi hindi daw nagamit yung calculator. Pero by this time, no, sana naman magamit man o hindi, happy kayo, no, kasi ready naman tayo for preventive medicine na exam. So, okay tayo sa odds ratio, okay tayo sa relative risk, okay tayo sa computation, interpretation ng ating bell curve, yung ating empirical rule, and then your common mortality statistics. Let's move on to your graph. Remember guys, na ang graph natin, it is a tool para mas mapaabot natin sa ating mga viewers or listeners yung ating message of the data that we have. Okay? Now, kapag walang graph, usually it's in a text form, no? Ito naman, kapag yung text convert mo into graph, it is in a graphical form. Now, previously, natanong siya kung ano daw yung difference ng horizontal bar versus vertical bar. Again, as a review, para doon sa mga nagpapanik na, ang horizontal bar nyo, ayun yung nakahigang bar. Starts with letter H, higa. Yung vertical bar nyo, ayun yung mga bar na nakatayo. Imagine your bar nakatayo na V-shape. Okay, ayan. Very no-brainer. Pero yung iba sa sobrang panic, horizontal, vertical. Again, remember, horizontal, higa, vertical tayo. Now, ang sabi, okay, ang horizontal bar charts, when you are graphing nominal variables. Does it ring a bell? Okay, nominal. You can categorize your nominal as your categorical data. Your categorical or your qualitative type of data. So kapag nominal lang inyong variables, you can use your horizontal bar. Okay, nakahiga. Kaya dito nakita nyo mga names lang, mga nominated, nominal names. Versus your vertical bars, when you are graphing your ordinal variables. If there are order or ordinal variables, you use your vertical chart. Example here is the order, no? Ito order of grade to ng grading system in the United States, A, B, C, D, and F. Okay? So ordinal values yan. So again, ayun pinaka-difference sa categorical, nominal, horizontal, ordinal, nakatayo, vertical. So again, importante na comfortable kayo. Review tayo. Ang data types so dalawang klase, categorical and numerical. From the past boards, tinatanong lang nila, you will be given a variable and then you will try to identify whether it is categorical and numerical. Your categorical can be divided into your nominal or ordinal. And then your numerical, interval, and ratio. Other permutation, categorical, qualitative type of data. Numerical, quantitative type of data. Remember that. Okay, qualitative versus quantitative, categorical versus numerical. Ito, ilang beses namin to paulit-ulit, no, sa handout and sa buzzwords and ating summary lecture. Ang ratio natin, 0 is not arbitrary, meaning your 0 here is fixed. Interval, 0 is arbitrary. Best example natin dito na paulit-ulit kami, it's your temperature. And then ordinal, there's rank and order. Nominal is just categorical. And usually here, meron tayong tinatawag na dichotomous. Pag sinabing dichotomous, dalawa lang yung inyong variable, pwedeng yes or no, male, female, agree, disagree. Pero yung agree nyo at yung disagree nyo, nagkaroon na ng order, iba yung usapan na yon. Pero kung dalawa lang, dichotomous siya. Okay? So this is your scales to measure data. Let's move on. Another computation. Siyempre, hindi naman matatapos ang review natin kung walang specificity. So let's try to review for your specificity. Given this case, try to make a 2x2 table and compute for the specificity. Go. Okay, meron ng mga nagbigay ng kanilang sagot. Okay, so again, 2 by 2 table natin. By this time, ang pag-uusapan natin is the condition on top and then yung smoking status here. So sinabi dito, 90% of people with lung cancer are smokers. So it automatic, if you are given a percentage, you know that if it is 90, the total is 100. Out of the 100%, or gawin na lang natin number of patients, 90 ang may lung cancer. Kaya kung makikita nyo, 90 ang may lung cancer. Remaining is 10. Now, on the other hand, 30% of the people without lung cancer are also smokers. So here, without lung cancer, pero smoker. And then remaining niya is 17. Now, yung iba malilito dito kasi hindi kayo nakakita ng apat na figure, apat na number. You try to derive it from the case. Since you are given a percentage here, meaning total lang naman ang percentage is usually 100. So ang remaining nun, depende na kung ano yung cell na kailangan mong fill up. Previously sa buzzwords na pag-usapan natin, okay, kung ano yung meaning ng mga nomenclature ng true positive, false negative, and true negative. I advise kapag specificity at sensitivity ang pinag-uusapan, gumawa na kayo kagad ng 2 by 2 table na nakaganito. PP, FP, FN, PN. Ngayon, minsan A, B, C, and D. Okay? Okay tayo doon. Now, how do you apply it? Ito lang naman yon. Alisin natin yung ano. How do we clear? Clear. Ayan, eraser. Ayan. This is our summary of the 2 by 2 table. And as you can see here, no, yung ating formula. Ano ang tinatanong ulit ng ating tanong? It's your specificity. So specificity is a vertical analysis, specifically this one. So you just need to supply the numbers based on your 2 by 2 table and you will get 70 over 70 plus 30. And that is 0.7. Now, if you were going to convert this into a percentage, you just need to multiply it by 100 and you will get the specificity of 70%. Okay? Now, let's try to compute for the sensitivity. Using the same 2 by 2 table, compute for the sensitivity. Sige, I'll provide the 2 by 2 table and I'll provide na the formula. Just compute for the sensitivity. Okay, very good. Mukhang natuto na lahat kasi nakuha na nila yung sagot, which is 90%. Again, moral lesson for the 2 by 2 table. This is also applicable to your NPV and your PPV, your negative predictive value and your positive predictive value. It is just your horizontal analysis o yung mga nakahiga. So again, advice ko kapag mag-e-exam na kayo on Prevmed, you write immediately your 2 by 2 table with the formula habang hindi pa kayo sagad na papagod nagbabasa ng mga cases. Make sure tama yung pag-supply nyo ng mga definitions. Alright? Let's move on to another important concept. Pero before that, I think medyo kailangan muna natin ipahinga yung ating mga utak. Siguro mga 2 to 3 minutes. Pwede kayo mag-bladder break. So, sige, pwede ako mag-ano muna, story time. Kung may tatanong kayo dito habang umihi kayo. Ano lang, pangpakalma lang tayo ulit kasi another big topic na naman ito na kailangan mas matutunan mo. So anyways, kamusta na kayo while waiting? Sige. Pagpag lang tayo, pang-relax lang. Sige, relax lang kayo. If you have any questions na pangkalma lang, pwede. While nagbo-bladder break tayo. Tsikahin ko lang kayo. Your family structure, hindi siya included dito because na-include ko na siya ng buzzwords. Pero I can explain it right now if you want, okay? Usually naman ang tinatanong lang sa family structure is your extended, your blended, your communal, and your nuclear. Okay, these are your family type and structure. Again, pag sinabi natin nuclear, ayun yung usual composition ng family. Okay, meron kang tatay, nanay, mga anak, pero walang kasamang extensions. Maternal man yan or paternal, nuclear. Pag extended, ayun, may pumasok ka ng mga kamag-anak, pinsan, lola, uncle, auntie. Actually, yung extended, pwede mo pa siyang i-clarify. Pwede siyang maging matriarchal extension or patriarchal extension or maternal extension, paternal extension. Ibig sabihin, yung extended family ay kamag-anak ni nanay kapag maternal extension. Kapag paternal extension, kamag-anak ni tatay. Ang blended naman, ayun yung nag-blend na yung two families before. For example, ikaw ay hiwalay. Ang best example ng blended, ano ba yung mga, well, kaibigan ko pala, hindi pala artista yun. For example, sabihin na natin si Mommy A, no, meron siyang 2 anak from the previous marriage, naghiwalay na sila, tapos nag-asawa siya ng bago na may 2 anak, so blended na yon. Ang communal, it's a group of people. They are not related by blood, but they are grouped together because they're under one company, school, no, fraternity, yung mga yan, yung mga may pinaglalaban sila. Kaya nga, di ba, meron tayong tinatawag na, kunwari, ABS-CBN family, okay, so ayun yung mga usual. And then, syempre, single parent family. Single parent, mag-isa ka lang, hiwalay ka. One definition yon. Meron naman yung asawa mo malayo sa iyo. Okay? Nag-abroad o kaya na destino sa ibang lugar. Okay? Kunwari taga Iloilo ka tapos yung trabaho ng asawa mo taga Tugigaraw. So mag-isa ka lang, single parent pa din yon. Hindi naman ibig sabihin hiwalay ka. Pamahiin, alam niyo wala akong pamahiin. Wala akong pamahiin. I mean, basta ang ginawa ko lang nung nagpe-prepare ako sa boards, I choose to be kind. Wow. Talagang mabait-baitan ako, ganyan. As in, hindi ako negative, positive ako lagi. Nung day 4, minake sure ko na nakapag-ayos ako, mabango ako sa mga girls, talagang naka-makeup, lipstick, mascara, para kahit tsakang-tsaka ka na sa sarili mo, pagod na pagod ka na, maganda ka pa din. Okay? So you can wear your best clothes. No? Huwag na ba kayo mag-gown habang nag-boards? Baka hindi kayo papasukin. Magpabango kayo, ayun, chumika kayo, tsikahin niyo yung mga jowa niyo, tsikahin yung mga loved ones niyo, maging maging malambing. Okay? At actually, I had difficulty. Nung nag-buzzwords tayo, may nagtanong sa akin, Doc, paano po kung yung anak, yung parehas na magulang, abroad, tapos may isa silang anak, iniwan sa Pilipinas, pero ang nag-aalaga, yaya. Yaya lang talaga. Ano ang tawag mo doon? Nung una inisip ko, jokingly, abandonado yung bata. Pero actually, I'm really having a hard time answering that question. Pero if you're given a chance na sumagot sa boards at ang choices ay extension, extended, nuclear, communal or blended. Ako, for me, ang pinaka-best answer pa rin is extension based on our culture as Filipinos, di ba? Kahit hindi siya blood related, and entrust mo na doon sa yaya. Pero kung wala dun sa choices, nako, kawawa naman yung iniwan lang sa yaya kahit hindi man lang sa lola or tita, as in yaya not blood related. Ayun. Pero I'll try to look for a literature. Pero nag-try din ako mag-search ng isang araw, wala rin ako masyadong makitang literature. Yung iba tinatawag, not related extension. Kung may ganon, hindi go. Okay? Sige. Sige. Pahinga muna yung iba. Paano daw nakuha yung 16% kanina? 'Di ba naalala mo yung empirical rule na 68? Ano yung next natin? 95 tsaka 99.7 rule. 'Di ba? Yung mga yan, ito lang yan. One standard deviation daw, plus or minus, makukuha mo 68%. So hinati mo lang tong standard deviation natin into the negative 1 here, positive 1 here. So ito, nagre-represent siya ng 68%. Pag hinati mo siya equally, it's 34 plus 34. Okay? Tapos, syempre, alam mo na 68%. So, ano yung next box natin na blue? That is 95%. So, syempre, meron ka ng 68. You just add here 13.5 plus 13.5. Ang total niyan, all in all, 13.5, 34, 34, 13.5 is 95%. And then yung remaining mo na third standard deviation to the right and to the left, no, you have your 2.35%. Syempre, 99.7 lang yon. Kaya yung outside, the third standard deviation nyo, yung pinakadulo na, that represents your 0.15% to the right and 0.15% to the left. Okay, so that's how you furtherly dissect your bell curve. Okay? Tapos dito kung may mnemonic daw ba sa formula, usually kapag mortality rate, no, yung in-explain ko kanina lahat by 1,000, okay, magkakatalo-talo na lang yun yung factor nyo kapag ang pinag-uusapan na natin is usually di ba 15,000, ang factor mo 1,000. Kapag ang factor mo nasa 100,000s na, usually no, pwedeng gumamit doon ng mga factor na 10,000, 100,000, depende kung millions na pinag-uusapan. Pero for safety lang naman, in healthcare, usually 1,000 ang factor natin. Except kapag ang pinag-uusapan ay proportion or percentage. Guys, kapag percentage ang pinag-uusapan, usually it's 100. No, yung mga prevalence, yung mga ganyan, sensitivity, specificity. Okay, sige, mukhang nakalmado na ang ating mga brains. Ito, last na to ha. Last na to. Yung mga hindi ko masasagot na miss ko, you can message your Mother Goose and then I'll try to answer it. Okay? Additional pahabol readings for Prevmed exam, especially on recent public health cases like Nipah virus, monkeypox, or the new slogans of DOH programs. Usually, ang exam na prepare na siya months before the boards. So, kung ini-expect nyo, kunwari, lumabas ng Nipah virus, ngayong buwan or na nakaraang buwan lang, na-finalize yung mga questions months before pa. So, usually, yung mga recent trends, hindi siya ganun nakakahabol kagad. Okay? Ano siya, board exam next season pa siya, ganun. Okay? So, you just relax, you just focus sa top-notch content, pearls, and main handout, kasi ito yung talagang curated na, pinag-isipan na ilang seasons na yung dumaan, na meron talagang, nag-focus tayo doon sa mga, we are giving you the best possible parang content para mag-survive. Okay, sige, enough of the sideline kwento. Thank you so much. Mukhang nakapag-relax na kayo, bumaba na ang inyong blood pressure sa competition. Let's talk about our hypothesis testing. From the previous exam, ang pinaka-main focus natin dito sa hypothesis testing is on how you interpret it. For sure, right now, you know the type 1 beta error, your type 2 alpha error, alam niyo na yung mga yan. Pero how do we go there? How do we decide whether we will reject or we will not reject the null hypothesis? So let's review. First, we need to understand the null hypothesis. It is written as your H naught. Okay, this is how you are writing your null hypothesis. Your null hypothesis is a statement of no effect, no difference, or equality. From the word null, kasi nga ibig sabihin, you are not believing in this statement. Okay, na ba't ka pa nag-research kung alam mo naman pala na walang effect, walang difference, right? So it represents your status quo or your default assumption. Pero the researchers believe into something else, and that is your alternative hypothesis. It is written as your H sub A or H sub 1. Now, once na you already have your null hypothesis, kahit anumang research yan, okay, you need to calculate the test statistics depending on the data pool. Okay. Now, in calculating the test statistics, no, usually, I'll explain it later, yung mga test statistics natin. Pinag-uusapan natin yung t-statistics, ayan yung t-test, paired t-test, your chi-square. Promise, later on, I'll make this simple. And then your f-statistics is just a continuation of your ANOVA, okay, using an F table. Now, you choose the statistics and then you calculate the p-value. Ang p-value natin, listen to this, is the probability of obtaining result an extreme or more extreme. Okay? So kung kino-compute ang p-value. Okay? So kasi ang ayaw lang natin na nag-calculate tayo ng test statistics tapos by random lang pala nangyari yon. As much as possible dapat scientific base. So again, Doc, saan po nagagaling ang p-value? Kinakalculate ang p-value depending on the test statistics, depending on the data pool. Limitation ko na yon ha, kasi never naman nagpa-compute ng p-value directly. Okay? So ngayon, you will compare the computed p-value to the significance level or alpha. Doc, saan po nanggaling yung alpha level or your significance level? This one is already preset na ito. Ibig sabihin, kung ikaw ang researcher, we will set our significance level, for example, at 0.05. Okay? Meron din naman 0.01. Kung i-convert nyo yan, it's 95%. This one naman is, meron din naman 99%, and then meron ding 91%. Ito ang rule natin. Sa exam, kapag sinabi ang alpha na 0.05, so be it. Paano kung walang sinabing significance of alpha? Significance level or alpha? Automatic, no? Based on literature, kapag walang sinabing significance level, automatic, you will assume that the significance level is 0.05. Pero syempre, sana naman yung ating mga exam maker, question maker, i-provide nila yon para at least wala kayong doubt. Pero kapag walang provided, significance level, 0.05. Ito ngayon yung ginagamit or tinatanong sa board exam on how you will use the data. Now, you will usually sa exam, you'll be provided a p-value. And then the exam will provide the significance level. Ang kailangan mong gawin is interpret. Now, if the p-value is less than or equal to alpha, ang decision natin is you reject the null hypothesis. Okay? If less than or equal, reject the null hypothesis. But if your alpha is greater, if your p-value is greater than your alpha, then you do not reject the null hypothesis. Okay? Remember that. Now, let's try to apply na yung knowledge na shinare ko sa inyo. After analyzing the data, you calculate a p-value of 0.03. What is now your statistical decision given an alpha of 0.5? So again, p-value mo is 0.03. This is less than your alpha, which is 0.5. What is your decision? Again, the value of p-value is 0.3. It is less than the alpha, which means that your p is less than your alpha. So since your p-value is less than your alpha, you reject the null hypothesis. Very good. Na-reject nyo na. So I'll be giving you a scenario. By this time, you're on your own. Try to answer this. Ang null hypothesis, the new drug has no effect on blood pressure. Again, as a review, no effect, no difference, equality. Ang alternative hypothesis natin is the new drug is effective in reducing blood pressure. Mabait ang examiner, binigay ang alpha, 0.05. Now, this is the scenario. The p-value is less than the significance level of 0.05. So the pharmaceutical company did not reject the null hypothesis. What is the type of error done? Dalawa lang naman yung errors natin. Sige, isip. Ano kayang error ang ginawa? Very good. Very good, guys. It is your type 2 error or your beta error. Okay, again, this is from your handout. Okay, ang reality natin, kapag ang inyong p-value is less than your p-value is less than your alpha, you reject it. Kapag hindi nyo reject, that is your type 2 error. Ibig sabihin, kapag i-reject mo yung null hypothesis, your null hypothesis is false. Correct? Pero pag hindi nyo siya reject, it's a type 2 error. That is the opposite of if your null hypothesis is true, okay, and then you reject the null hypothesis, that is your type 1 error. Alright? So, at the fact na nasagot nyo yung type 2, I think I am confident na okay na kayo. Now, let's try to review the different study designs. Try to read the case, try to read the research, and then you give me the study design. Ang mga study designs natin, ayan yung case series. Ang case report, ayan yung one case of a patient, usually rare, no? Case series, ayan yung almost the same symptomatology, mga 3, 4, 5, 10 patients. Okay, 10 cases. Sorry, salita si Siri. And then you have your case control, your prevalence, your cohort, okay? Then you have your randomized controlled trial, you have your meta-analysis, you have your anong tawag dito? Meta-analysis and your systematic review. Pero based on this case, what do you think is the study design being used? Go, answer. Nag-research records of individual diagnosed with their condition and compare them to the medical records of individuals who do not have the condition. So you have here the diagnosed, you have here the cases, and then you don't have the condition. These are your control. So if you have the cases and control, and then you'll try to check the development of the condition. So you started first with the condition, na may cases, may control, and then you will look for the risk factor outcome. Then this is a case control study. Now, kung rare at sinagot mo ay case report, nagkakamali ka. Kasi ang daming records nito. Okay? Kung case series naman, hindi pa rin. Kasi yung case series, lahat yun, cases lang, walang control. Dito kasi may with diagnosis and without diagnosis. So this is your cases and control. Best answer here is case control study. Guys, ganito kahaba yung mga cases sa Prevmed. So kailangan magbasa tayo na mabuti. Next case. Try to read it first. Okay, marami na ang sumasagot. In a medical research publication, the authors provide a detailed and comprehensive description of single patient's unique medical history. Oh, single patient lang. Wala nang usap-usap to. This is a case report. Very good. Ayan, galing-galing nyo na. O, next case tayo. Okay, try to read it and answer. Pag nakita ko may sumagot na, ibig sabihin I can discuss. Ang bilis-bilis naman. Parang ready na kayo sa Prevmed. Okay, marami nang sumasagot. This is your cohort. Okay, again, cohort, inferential statistics, relative risk. But here you can see that they divided the groups into your smoker and non-smoker. And we all know that your smoking is your exposure. Okay, and then determine who among them would die at 20 years. So it is a prospective type after 20 years. At ang ating outcome is your death. Siguro by cancer. Death or by, siguro by this time, cancer. And you know that your death or cancer is your outcome. So this is the, yung parang, the methodology of your cohort outcome. So this is a cohort, specifically a prospective type of cohort. Very good. Para dun sa mga sinagot na prospective, ginalingan nyo masyado. Next case. Go read the case and try to answer kung ano siyang study design. Okay. So a randomly selected group of hypertensive stage 1 patients were divided into your treatment and your placebo group. The treatment group were given amlodipine while the control group was given diet and placebo. Ang outcome, decrease in blood pressure. The study design here is your randomized controlled trial. For those who answered experimental, okay lang, very good pa din. Pero yung experimental is somehow an umbrella term. But if you're going to be more specific, it is your randomized controlled trial. Okay lang yan. Multiple choice po ang exam. So kung nakita na may randomized controlled trial, you answered it. Kung walang randomized controlled trial pero nandoon na experimental, you choose experimental. Ngayon para doon sa mga nantsatsarot, doon kung paano parehas nandoon, di ipagdasal mo na lang pero you choose the most correct, which is your randomized controlled trial. Ganun lagi kayo no? Thinking of the extremes. Okay. Dito naman, try to answer. Read the case and try to answer. Be responsive as possible. Okay. Again, anong tawag dito? Be responsive. When I say responsive, you try to answer what the question is asking. Ano ang tinatanong ng ating tanong? Tinatanong ng ating tanong is, what would the most appropriate measure to measure the strength of the association? Again, we are talking about your statistics, your inferential statistics. Very easy question, but difficult to comprehend. So the best answer here is, again, you have your vape users and non-vape users who will develop your pneumoconiosis. So you have here your exposure. Okay, and then who will develop? Who will? Ibig sabihin, sino yung magkakasakit? So it's most likely a prospective cohort. Ang outcome, pneumoconiosis. So this question is a cohort, a prospective type of cohort. Very good na-identify nyo. Pero ang tinatanong, anong statistics na gagamitin? Your relative risk. Alright? So guys, be careful lang in identifying your study designs, pero lagi kayong dinilito sa cohort, case control. Cohort, case control. Now, kung nakita nyo kung paano ko siya dinaisect, try to copy it. You look for the outcome. You look for the exposure. Kapag may nakita kayong time element, who will develop? We will follow in 10, 15, 20 years. Bonus na yon. That is already a prospective type of cohort. Okay, sige. Relax na muna tayo. Inhale, exhale. Inhale, exhale. I-tap ang sarili. I-tap ang sarili. Sabihan mo, good job. Konti na lang, matatapos na. Relax tayo. Habang nag-relax tayo, guys, para doon sa mga nakakaalam na ng ating Gaussian curve, okay lang yan, ha? Pero i-explain ko lang konti para doon sa mga medyo nalilito pa. Ang tanong natin is, Doc, saan po nanggaling yung 13.5%? Okay, very nice question naman yan. Valid ang question mo. Again, we have the 68, the 95, and the 99.7 rule. Sinabi natin na sa first standard deviation, automatic 68% na siya. Diba? Ngayon, itong dalawang standard deviation, automatic, it is 95%. Ang tanong is, saan po galing yung 13.5? To the left and to the right. Again, 34 plus 34 is 68. That is one standard deviation. Pero syempre, ang sabi natin, kapag within two standard deviation na, dapat ang total mo na is 95. So how do we get it? Saan nanggaling yung 13.5? Try to add this, Doc. 68, or ito na lang, para mas sure. 34 plus 34 plus 13.5 plus 13.5. What is your answer? It's 95%. So, ibig sabihin, yung 95% ay hinati lang natin equally to the left and to the right. Ngayon, kung tatanungin mo ako ulit, Doc, saan naman po nanggaling yung 2.35? Do this. Try to add 95 plus 2.35 plus 2.35. You will get 99.7% because that is already your 3 standard deviation, 99.7. Doc, dapat 100%. Kaya nga yung mga beyond the third standard deviation na positive and negative, meron tayo ditong 0.15 and 0.15. Okay? So sana nakuha na ha kung saan na-derive yung 13.5 to the right and 13.5 to the left. Hinati lang natin siya. Kasi nga we are following the empirical rule. Unfortunately, no, ilang beses na siya natanong, it's better for you to be ready on how to tackle this type of question. And I am confident, no, na masasagot mo yan. Okay, let's move on to the next topic. Ito madalas yung mga tinatanong, the different study designs. We have the t-test, the paired t-test, the ANOVA. Ang meaning ng ANOVA is analysis of variance. And then we have the chi-square test. Remember, sa t-test, t-test or T, kaya siya T, no? Kasi meron tayong T-table. Doon natin kino-compare yung mga computed statistics. But for the sake of making it simple, remember that we are doing this t-test and paired t-test to compare the means, the average. Kasi usually we have two groups, di ba? Okay. Ang t-test nyo used to compare the means of two independent groups. So meaning, you have one group here, okay, and another group here. Whether kung ang variable na mini-measure mo ay height, weight, lipid profile, hemoglobin, okay lang yan. You are comparing two independent means. Ang paired t-test nyo, kaya siya paired, no? Usually kasi you will compare two means. Two means, pero ang groupings mo usually is from one. Pwedeng one person or one group lang. So it's before and after. Kaya siya paired. Okay? Again, dalawa pa din yung means na kino-compare mo, but this time from one participant or from one group. Versus your t-test, you have two independent groups. Okay tayo doon. Ayun naman ang common talaga na ginagawa natin. Kino-compare natin yung dalawang groups. Paano kung ikaw gusto mo i-compare more than two groups? For example, you have 3 independent groups. Hindi na pwede yung t-test dyan kasi nga sa t-test, 2 means lang. Dito, kapag more than 2 or 3 groups ka na, ang gagamitin mo na ay analysis of variance. Okay? So, you will compare now 3 or more independent groups. Ganun ka-giveaway ang ANOVA. Ang chi-square na marami ang nalilito to determine the association. If one variable is associated to another variable. Pero nalilito kasi yung mga tao. Pag nabasa nila yung association, automatic chi-square na. Kailangan, itry mo na munang i-identify yung mga variables. So kung ang variables present in the case is categorical, again, qualitative, ang categorical natin, okay, qualitative, dalawa siyang qualitative categorical variable, then most likely baka ang magandang statistics na gamitin ay chi-square. Nagkakaintindihan ba tayo doon? So by this time, dapat comfortable kayo, t-test, dalawang group. Paired t-test, isang group, dalawang means, before and after. ANOVA, tatlong groups. Chi-square, dalawang categorical variables. So with that simple definition, you'll be guided now on how to choose the best statistics. Now, let's try to choose the test statistics here. Based on this case, what is your best recommendation? Type in your answer. What is your best recommendation? Okay, may mga sumagot na. Very good. Habol, habol sagot. Okay, now evaluating the effectiveness of 3 different physical therapy methods. No, you have group A, group B, and your group C, improving the mobility of patients with knee injuries. So the best statistic here is ANOVA. Again, kung walang ANOVA, you try to read the whole, the analysis of variance. Usually sa ANOVA natin ginagamit, no, diyan tayo gumagamit ng mga post hoc na computation. Pero limitation na natin 'yon, no? Kasi hindi naman siya usually nagtatanong. Now, if you're going to ask me, Doc, magko-compute ba kami ng ANOVA? Sobrang para sa isang question, talaga ba? Iko-compute natin yan? Gumagamit na tayo ng mga statistical software ngayon para mag-compute. So, pang GP tayo, general practitioner level tayo. Next case, try to identify. Ito medyo challenging to. Pero kung pinanghawakan nyo lang yung definition na binigay ko sa inyo, hindi kayo magiging. Again, sige, try to answer na. Again, review. Pag t-test, you are comparing two groups. Pero yung two groups na yon dapat meron ka mean. Di ba? And usually, yung mean na yan, nako-compute yan from your quantitative data. Kasi hindi ka naman pwede mag-compute ng mean kung categorical lang. Pwede, pero the mean of that category. Pero yung mga numerical mean, it is from the quantitative type of data. Now, kaya importante, di ba, laging dinidiscuss natin sa biostatistics yung mga types of data. Because that's our foundation whether we're going to use a quantitative, qualitative type of test statistics. So for this time, look at this scenario. Smoking status. Ibig sabihin ng smoking status, smoker ako or hindi ako nagsusmoke. What type of data is this? Quantitative or qualitative? Hindi, walang number dito. Qualitative. Specifically, dichotomous type of qualitative data. Two answers, smoker, non-smoker. Now, ito yung isa nating variable, smoking status. Ang next natin na variable is the outcome, lung cancer. With lung CA, without lung CA. Again, it is just a qualitative type of data, categorical. So given this type of analysis, the best answer here is your very good. Almost all of you naman got chi-square. Okay, good job. Perfect, nag-i-improve na tayo. Next case. Ayan, I'm so proud of you guys. Oo. No, na-appreciate yun na, kaya doon pumapasok dapat alam niyo yung mga types of data. Okay. Sige. I mean, yung mga sagot nyo, based dun sa first discussion ko, yung apat, ha? Sige. Ang t-test natin again, we are comparing means. Kapag sinabi nating means, ibig sabihin, dapat numerical. Ang blood glucose level natin, no? Kung ito ay lalagyan natin ng type of data, is this a ratio or interval? It is actually a ratio, right? Blood glucose level, for example, 128 milligrams per deciliter. Okay? So it's a ratio because you know that the zero here is fixed. Na kapag sinabi mong zero ang blood glucose level, it's zero. So it means to say that, okay, we are dealing with a means. Mukhang t-test ito. Okay? Pero para masabi mo na ang t-test mo ay t-test alone or it's a paired t-test, kailangan tignan mo yung number of groups. Okay? How many groups do we have here? Same group of diabetic patient. Only one group. Tas bonus na yung before and after. Before and after. So, ibig sabihin, the best statistic here is paired t-test. Very good. Ayan, a round of applause. So, sana mas nagiging confident kayo no, in identifying the different statistics. O lastly, okay, I think nakuha nyo na. Mayabang na. Mabilis na sumagot. Okay, so if we are talking about tests again, we are checking for comparing the means. The variable here is blood pressure. Blood pressure, it is a quantitative type of data. Specifically, it's a ratio, okay, because we all know that the blood pressure of zero talaga ang blood pressure. So, pwede siyang 120 over 8 millimeters mercury. So, there's a mean, comparison of mean. Okay, t-test siya. Pero gusto mong siguraduhin kung siya ba ay t-test or paired t-test. So, ang best answer is look for the groups. Sinabi dito, male, female. Kinategorize siya into male, female. Okay, nako, categorical ito. Chi-square kaya. Kaso nga lang, pinasok to between two groups. So, mean of the male, and then we have the means of the female. So, we have two groups comparing their means. The best answer here is t-test. Okay? Okay tayo, happy naman tayo doon sa ating mga statistical tests. So, hopefully, no, magamit natin yan sa day 4. Now, let's talk about your prevalence and your incidence. From my main lecture, tinuruan ko kayo kung paano i-interpret yung mga graphical prevalence. Remember yung mga graph na ganyan? Ayan, diba? That's how we count. So sabihin na natin, this is the month of August. Okay? So the month of August, yung mga lines na yan, that represents your cases. Okay? So ito ay July. This is your September. So kapag tinanong ko kayo, what is the incidence sa buwan ng August? If the line here represents one case, how many ang ating case incidence? Sige nga, try ko lang kung nakakapag-interpret pa kayo ng graph. Very good. Okay, may nakakuha pa. It is 3 cases. Ibig sabihin, new cases in the month of August, on the month of August, 1, 2, and 3. Pero ang prevalence nyo for the month of August is 6. Very good. Nakuha nyo rin yun. So that's how we interpret your incidence and prevalence in a graphical graphical manner. Paano kung pagko-computed kayo? Dito papasok, this is from your main handout. Incidence, new cases, prevalence, number of cases. Kaya si Hodang luma, bago. Okay? So we will focus on the prevalence kasi previously ito yung pinifeedback na Doc, pinag-compute po kami ng prevalence. So you will just look at the total population and look for the cases. Okay? So, sample case. You are working in a small town with a population of 500 people, and you want to determine the prevalence of diabetes in this community. So, number of individuals with diabetes is 20. The total population at risk is 500. Compute for the prevalence of diabetes. This is very good. Sige, habol yung iba. Compute. 4%. Okay? So kanina, graphical interpretation. Ngayon is numerical computation. Pero ito yung pinakamadalas din na nilang tanungin. Common sense application. What are the factors influencing prevalence rate? Okay, so again, there are cases which you can increase the cases, and then they are decreased. All right, wait lang. Wait lang, guys. So kapag longer ang duration ng disease, you know that it will increase the prevalence. If you prolong the life of a patient which has the disease status na hindi na-cure, you will increase it. Siyempre, kung number of your incidents will increase, your prevalence will increase. In migration of cases, nadagdagan yung population mo na may mga sakit, umalis yung mga healthy, or pumasok yung mga population, yung patients na susceptible with a certain disease, or mas gumanda yung case finding, that will increase your prevalence. Siyempre, the opposite of that, you will decrease the prevalence. So I know this is very easy, pero please be careful in answering sa exam. Try to understand even the options. Sometimes yung option sobrang haba din, nakakapagod. Pero please lang guys, tiisin, okay? Sige, last concept na before tayo mag-hit ng 2 hours, no? By the dot tayo natapos 2 hours. Let's compare your independent variable and your dependent variable kasi pinapa-identify kayo neto sa boards. So usually, ang certain scenario here is you'll be given a case, a research title. And from that research title, you will identify kung alin doon yung independent variable or dependent variable. Okay? So as a review, ang independent variable, ito yung kayang i-manipulate ng mga researchers. Okay? Kayang i-manipulate, kayang i-adjust. Ang dependent variable usually is the responding behavior. Okay? Pwedeng ito yung response depending on the manipulation. And in the healthcare, researches, usually we are talking about your RCTs, diba? Yung effect ng treatment, no? Effect of your ginkgo biloba, effect of your coconut oil, etc., effect of the certain pharmacology, ganyan. So alam nyo na ha, independent, no-brainer, yung na-adjust, nagagalaw ng researcher, ng mga investigator. Independent, ayun yung outcome, ayun yung result based doon sa in-adjust. Okay? So I'll give you a case. Researchers are testing the effectiveness of a new medication on reducing blood pressure. What is your independent variable? So your independent variable here is your new medication because we can adjust that, no? Pwedeng low, medium, or high. Okay, and then your dependent variable is your reduction in blood pressure. Very good. Next case tayo. Parang na-move ko yung window. Ayan. Okay, so ang independent variable mo dito is your physical activity. Tapos ang inyong dependent variable is your weight loss. Okay, or your weight management. Very good. Now, I'm in my last slide. It's 1 hour 59 minutes na tayo. Baka lang matanong, no? Kasi may mga feedback na may smoking cessation, madaming COPD. In the point of view of preventive medicine, importante ang smoking cessation program. At ang laging tinatanong in practice and in the exam is your 5 A's approach. It is not enough for you to know the ask, the advise, the assess, the assist, the arrange. You should know the proper flow. Una, ang ask. Ask about tobacco use. Next, advise quitting. Next, you assess before you assist. After you assist, you arrange follow-up. Why? Usually ang choices, rumble. Lahat ito ang component. Hindi mo kinabisado yung pagkakasunod-sunod. Sayang naman ng 1 point. Again, ask, advise, assess, assist, arrange. And that is your smoking cessation program. So I'm on the right track. Tama, 2 hours. Again, thank you so much for listening. I know this day 4 pa, day 3 pa lang bukas. Pero sabi nga nila, no, kung nag-prepare ka ng maayos, then you will appreciate it. And sana mas naging comfortable kayo with the computation, nakapag-practice. Okay? Alam ko pagod na kayo, pero hindi pa tapos ang laban. Kailangan pa nating tirahin lahat yung mga yan. So better wear your protection, tira lang ng tira. Good luck and thank you so much.
All right, thank you very much, Doc Louis. Apologies kanina, sobrang hina ng signal ko from where I was earlier. I was on mobile and I didn't have my laptop with me. But now I'm back with my laptop. So, thank you very much, Doc Louis, man. Oh my God, Maring Louis, Ma'am Shi Louis. Ang ganda ng lecture. Parang naintindihan ko din siya kahit pa paano yung computation. Pero ayoko na mag-compute. Okay. So guys, so I hope that you learned a lot because I actually did. Na-recall ko uli yung aking mga Prevmed days na nag-exam ako noong 2017 pa. Oh my God, ayoko nang ulitin yun. Tapos guys ha, fair warning na lang. Kasi dati sa exam ko, share ko na lang din sa Prevmed exam ko. There are sometimes yung mga numbers dun sa questions. Sometimes may naliligaw na number na 0 dun sa next line ng sentence. Akala mo 100,000 lang yon, pero yun pala 1 million siya. So please pakitingnan ng maigi yung questions ninyo. Kasi kapag na-miss out mo yun, sayang yung 1 point na yun. Okay? Yun ang masasabi ko dun sa Prevmed from my previous experience. All right? So guys, we won't keep you that long kasi tomorrow is going to be the last 2 days. Okay, so day 3 and day 4. I hope that you're all prepared. I'm sure that you are prepared already. Guys, 2 buwan kayo nag-prepare para dito. Okay? Ibigay nyo ng lahat. Give it the best foot forward na guys. Alam kong pagod na lahat. Okay, guys, sabi ni Doc Louie kanina, pagod na ang lahat. Okay, malapit na kayong mental breakdown, I guess. But then again, last 2 days guys, ilaban na natin to. Okay? Kapag may mga concerns pa kayo, pag medyo kailangan yung kausap pa, you just have to message your MGs. This doesn't apply only to my babies here on the Zoom. This also applies to everyone, okay, who are watching this via the live stream portal natin sa Top Notch. Okay, if you are having troubles pa, you want to talk to someone, talk to your MGs, talk to us, talk to your mentors. Okay, so guys, thank you very much for attending the special lectures for preventive medicine. And thank you very much to Dr. Louis Mann for sharing, okay, his Prevmed lecture to us. All right. So thank you very much, everyone. Have a great evening. Matulog na kayong maaga mamaya. You have done everything. You have done your part. Good luck, everyone. We are really rooting for you and see you on the other side. Thank you and have a great evening.